Cushing disease.
Definition. Cushing disease, also called Cushing's disease, occurs when body makes too much cortisol, a hormone related to the body's stress response. It's a rare pituitary disorder that is progressive. That means that without treatment, it gets worse over time. With treatment, patients can lead active lives with fewer symptoms. Difference between Cushing syndrome and Cushing disease. Both illnesses come from too much cortisol in the body. In Cushing syndrome, also called Cushing's syndrome, excess cortisol can come from outside or inside the body. For example, it can come from using corticosteroid medications, such as prednisone. Or it can come from a pituitary or adrenal tumor causing the body to make too much cortisol. Cushing disease is a specific type of Cushing syndrome. It occurs when a pituitary tumor causes the body to make too much cortisol. Cushing disease is the most common form of endogenous, from the body, Cushing syndrome, and makes up about 70% of Cushing syndrome cases. Incidence. Cushing disease syndrome is rare. About 10 to 15 new cases per million people are diagnosed each year. Risk factors. Age. It is typically found in people ages 20 to 50. Sex. It affects roughly 3 times as many women as men. Causes. Cushing disease occurs when a pituitary adenoma, a non-cancerous, benign, tumor on the pea-sized pituitary gland, makes too much adrenocorticotropic hormone, ACTH. In response, the body's 2 adrenal glands, one atop each kidney, make too much cortisol. This causes problems with body's hormone balance. Only about 10% of pituitary adenomas make too much ACTH. The tumor can also be small, microadenoma, or large, macroadenoma. Sign and symptoms.
Cushing disease/syndrome can change appearance. Signs include
Round, red face, hump on back of neck, purple stretch marks, especially on the chest, armpits and belly. Skin changes, such as acne, excessive facial hair and easy bruising. Unusual, rapid weight gain, especially around the belly. Complications can include muscle weakness, vision problems, headaches, infections, osteoporosis, a condition that causes weak, brittle bones and bone loss, high blood pressure, high blood sugar or diabetes, extreme fatigue or trouble sleeping, depression, memory loss. In women, loss of periods, amenorrhea, and male pattern face and body hair, hirsutism. In men, trouble getting an erection. Diagnostic evaluation. History taking. The doctor will ask client if he uses or have recently used steroid medications, creams or inhalers that contain hydrocortisone, prednisone or dexamethasone. Doctor will also ask about use of birth control pills. Physical examination. Carry out thorough assessment of the patient to find out stretch mark, facial hair, round face, red face, weight gain, hump on back, fat distribution on abdomen, neck, armpit. Find the source of the extra hormones. ACTH dependent, caused by a pituitary tumor or, rarely, a tumor in another part of the body. ACTH independent, caused by overactive adrenal glands or an adrenal tumor. Blood tests measure the levels of ACTH and cortisol in blood. Take a blood sample in the morning because hormone levels change throughout the day. Urine tests measure cortisol in urine taking multiple samples. Late night saliva test, look at cortisol in saliva. Client will collect several samples just before midnight, when cortisol usually drops to its lowest level. A high level can indicate Cushing disease syndrome. MRI. This scan can help doctors see a pituitary tumor, including its size and location. Abdominal CT scan. Doctor will recommend this scan only if he thinks it's possible that client has an adrenal tumor. The scan can show a tumor, some of its features, and which side it's on. Dexamethasone suppression corticotropin releasing hormone stimulation test, DEX-CRH. If screening tests show high ACTH cortisol levels, this test is used to confirm the diagnosis. Client is given these medications to lower or raise certain hormones. This helps doctors see if symptoms are from Cushing disease syndrome or a condition such as depression, stress, kidney failure or alcoholism. Inferior petrosal and cavernous sinus sampling. If tests indicate that high ACTH is causing Cushing, find out if the problem is from pituitary gland or some other part of body, ectopic Cushing syndrome. Insert thin tubes called catheters into areas, sinuses, alongside pituitary gland. Monitor ACTH levels during the test. Management. Surgery. Surgery to remove a tumor causing the problem is often the first treatment for Cushing disease. At a specialized pituitary center, surgery to remove a small pituitary tumor has a success rate of 80 to 85%. Transsphenoidal surgery is used to remove pituitary tumors through the nose. This approach leaves no visible external scars and has few side effects and risks. Medication. Central acting inhibitors of ACTH, pasireotide, a somatostatin receptor ligand, or SRL, reduces ACTH to normal levels for about a quarter of patients. It lessens symptoms for others. Most see results within 2 months. This medication is injected and can cause side effects, including high blood sugar and diabetes, in more than half of patients. Adrenal-directed inhibition of steroidogenesis. Medications include ketoconazole, metirapine, mitothane and etomidate. They target the adrenal glands to lower cortisol levels. Glucocorticoid receptor blockade. Mifepristone is used to treat high blood sugar associated with Cushing syndrome. Mifepristone may improve other conditions brought on by too much cortisol. It can also cause low potassium levels, called hypokalemia, and vaginal bleeding. It's not recommended for women who wish to become pregnant. Radiation therapy. Some patients have an aggressive form of Cushing disease, and surgery and medication don't help. In these cases, a type of targeted radiation therapy called stereotactic radiosurgery is used to control hormone levels. This lets physicians shape the radiation beam to match the tumor while sparing healthy tissue. Medication and radiation therapy. Most patients who have had radiation therapy have medication for an extended period. We stop the medication, usually once a year, to see if the radiation worked.